The Wellness Revolution starts now.
Hello, I'm Dr. Steve Hotze. Welcome to today's program. We're going to talk about brain health and the effect that hormones have on your brain. Now, let me ask you a question. Do you have difficulty concentrating at work or performing certain tasks, basic tasks? Do you have trouble remembering people's names? Do you ever feel like you've lost part of your memory? You wondering, maybe I've got an early onset of Alzheimer's. You ever feel like you're in brain fog or a state of confusion, decreased mental sharpness, unable to focus clearly, short-term memory loss, or just feel depressed? These are all symptoms that have to do with your brain and your brain health. Now, your hormones can have a direct impact upon your brain function. Let me explain. The most important hormone that you have in your body, they're all important, but the most important is your thyroid hormone. Your thyroid hormone is produced by the thyroid gland in the neck, and it's secreted into the bloodstream. It doesn't do anything in the blood. The thyroid hormones have to enter the cells. In the cells, they enable the cells in their mitochondria to produce energy, and it's electrical energy. So when you go to a doctor and you get an EKG, he's measuring your electrocardiogram. That's the electrical current in your heart. You go to a neurosurgeon, you got problems with your brain, you're not thinking well, and they want to say, well, we're going to do an EEG, electroencephalogram. They're going to measure brain current, electrical current in your brain. And we know that the low production of energy, when people are hypothyroid, they develop all these symptoms of loss of mental function. They get brain fog, they can't focus, they're unable to concentrate, they have memory loss, their cognitive performance lacks, they have a problem with mental tasks and solving problems when they're low thyroid, and they get depressed. And then when you supplement thyroid hormone, natural thyroid hormone, boom, you're producing energy in the brain, and all of a sudden the brain's neurons work well again, and you can think well. So it's very common for people with low thyroid to have problems with brain health, brain function. Other hormones that are important in brain health are, in men, testosterone. Testosterone affects your initiative, your assertiveness, your sense of well-being, your self-confidence, your mood, your goal orientation, your drive, your directiveness, decisiveness, your analytical ability. All these are brain functions. And the testosterone affects that in men. It also affects your muscle tone, muscle mass, cardiovascular function, and romantic moods and inclinations. But most importantly, it makes a man think like a man. And these are important brain functions. So as men's hormones decline as they move through their life, they begin to have cognitive dysfunction. They don't think as clearly as they did, can't concentrate. They can't keep up like they did. I remember I had a young man who was in his 40s or 50s came in to see me, and he was working at a major oil company here in town in Houston. And he said he was really having problems, and he had a high-level executive position. He was having problems keeping up mentally with the young people on his staff. When they got into meetings, they would run circles around him. And I told him, well, I think he was about 50, and I said, at your age, your testosterone levels have declined, probably about a third of what they were in your 20s, and that's going to affect your mental capacity and your mental abilities. So we checked his thyroid. Sure enough, he was in a very low range, and we found that in society, men have much lower levels of testosterone than they did 50 or 60 years ago, and the reason is because of all the petrochemicals in the environment that have an adverse effect on the proper production of thyroid hormone and the utilization of thyroid hormone. And those chemicals, primarily petrochemical products, act as xenoestrogens. That is counterfeit estrogen in the man's system that really make him less masculine. And they have a feminizing effect. That may be some of the reason we're seeing some of the craziness in our society, maybe due to all these petrochemicals in the environment that are feminizing the males and not allowing them to produce high levels of of testosterone so they have normal male pattern behavior. So anyway, this gentleman, it was about 50, I put him on testosterone. And he came back in a month and said, it absolutely changed my life. I like to say testosterone in a male will put a tiger back in the tank. And I don't just mean your sexual tank, I'm talking about your brain function. And that's why that's so critical and important. And testosterone also, the active testosterone affects your ability to convert the inactive hormone T4 to T3, the active thyroid hormone. And that's why testosterone is very important in thyroid function at the cellular level. So they work in synergy together. In women, their hormones can adversely affect their mental function too, because the decline in hormones in women and an imbalance between estrogen and progesterone leads to the production of thyroid binding globulins, which glom onto thyroid hormones in the blood and don't allow them to be assimilated into the cells where they do their work. Thyroid hormones don't do anything in the blood. They enter the cells, and in the cells, the active thyroid hormone T3 is like a spark plug that activates the production of energy within the cells so your body functions well. And I've mentioned in earlier comments too, this is one of the reasons women, after they have a pregnancy and end up delivering the baby at the hospital, get postpartum depression because they get a decline in their progesterone, and that and they get estrogen dominance, and that adversely affects their thyroid function. So that can lead to a lot of problems with women who get depressed after they are baby blues and don't bounce back from it. Long term, they just need a little bit of thyroid hormone in association with progesterone to help them regain their production of energy so their brain functions well again and they think well again. So these are some very, and one other hormone too, and I mentioned it earlier, is the progesterone. Progesterone declines as women age. They have anti-ovulatory cycles. Progesterone is made by the ovary at mid-cycle when a woman ovulates, and it balances out the estrogen hormones. So when women, as they mature, they have anovulatory cycles. They don't ovulate. They're not going to make progesterone that month. They're going to be estrogen dominance. That adversely affects the thyroid hormone, and it adversely affects energy production within every cell in your body, particularly the brain. So if you want to have good brain health, you've got to have good hormonal health and hormonal balance. And we do that here at the Hotze Health and Wellness Center. And if you'd like some information about it, feel free to contact us at 281-698-8698. And also, you can ask for this book, which I'll give to you complimentary. And I'll send it to you free of charge. I want you to understand about how your body functions. I want to educate you. The better educated you are, the better you can take care of yourself. And in these days and times, we need right-thinking people that are well-grounded in their faith and well-grounded in their convictions about what's right and what's wrong and about freedom in society and about our personal freedoms and our liberties. We need people like you to be healthy and well, to be able to oppose and defeat those who would try to take away our rights. That's why I want you to get this book so you can educate yourself and become conversant on the issues that you face health-wise, so you won't be buffaloed into taking a bunch of prescription drugs by some conventional doctor who puts you on antidepressants and other medication trying to help you with your brain function. I know you can balance out your brain with your hormones. And also, let me make a key point, you got to eat healthy too on top of that. And there's some vitamins and minerals that we can also share with you. And I talk about that in the book that can also help you with your cognitive function. So feel free to call us at Hotze Health and Wellness Center at the number on the screen. That's 281-698-8698, and ask for a copy of my book, Hormones, Health, and Happiness. Thanks for joining us today. I'm Dr. Steve Hotze.
At Physicians Preference Pharmacy, we understand that the quality of your compounded medications directly affects the way you feel, which is why we believe that your pharmacy should specialize in compounding medications while also delivering extraordinary hospitality and guest service. We believe that both patients and prescribers should accept nothing less than consistency and quality from their compounding pharmacy. This is why we've implemented some of the strictest quality standards in compounding, exceeding standard requirements, achieving PCAB accreditation, which is the Pharmacy Compounding Accreditation Board, an organization that sets the highest standards in compounding pharmacy regarding the safety, cleanliness, and quality of your compounded prescriptions. Because of our commitment to complete health and wellness, we are dedicated to making your medications free of lactose, parabens, artificial sweeteners, and any unnecessary dyes, binders, or fillers present in many other medications, offering you the cleanest products possible.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.